Hello and welcome to another webinar on COVID-19 and mental health. My name is Niall Boyce. I'm the editor of The Lancet Psychiatry, and it's a real pleasure to be chairing today. This is, of course, a joint venture between us, The Lancet Psychiatry, our friends at United for Global Mental Health, and also MHPSS and the Mental Health Innovation Network. And we've been very grateful for the support and enthusiasm of WHO throughout these webinars. Now, of the many things which have changed following the pandemic, I think that the world of work is really one of the hardest hit, one of the most remarkable changes. There are questions not only of the economic impact of the pandemic in terms of employment, but also in terms of long-term effects on the nature of work, in terms of where people work, how people work, the nature of the jobs they do. And of course, all of this will have an impact on mental health. Now, to help us to think about these things and hopefully untangle the issues and get to some practical points for change, I'm very pleased to be joined by today's expert panel. And they are Sir Graham Thornicroft of King's College London. He's a British psychiatrist, researcher and professor of community psychiatry there. We also have Enoch Lee, who is the founder and managing director at Bearapy. Also Emma Codd, who is global inclusion leader at Deloitte. And finally, Sapna Mahajan, who is the director of the Mental Health Commission of Canada and also of the Centre of Expertise on Workplace Mental Health. So I'd like to start off by asking Graham a question, which is regardless, let's just put COVID-19 to one side for a moment if we can do that, and just start off with a very basic question. Why is the workplace an important environment in which to address mental health?
Thank you, Niall, and hello, everybody. So first of all, let's think about the implications of work and mental health problems. Well, it can go in any direction. We can see the workplace as the cause of mental health problems, as the context, and also the consequences of mental illness taking place in the workplace as well. But first of all, let's just think about the huge scale of the challenge here. So we know that this year, the impact of mental ill health will be about $2.5 billion throughout the world. And this is projected to rise to $6 trillion by 2030. And this year, it's estimated that about 12 billion days are lost to productive work because of mental ill health. So this affects everybody. And what's the significance of it? Well, because we know that we can intervene in the workplace effectively. And people sometimes think this is people being off sick. Well, that's part of the problem. The estimates are that about 4 or 5 times the impact, the economic impact in the workplace is from presenteeism, people being present in the work and underperforming, than it is from absenteeism. Remembering the cost implications also include re-recruitment and also compensation claims. So we then can think about the return on investment if you do effectively intervene to promote mental health. And the estimates are between $3, $4 to $5 return you get for every dollar you invest to improve mental health in the workplace.
Okay, so that takes us up maybe to the pre-COVID situation. Let's talk about where we are now. What has been the impact of this pandemic on workplace mental health? And how do you think that businesses can best address this?
So I think we could perhaps think about this in 2 ways, Niall. First is if you like, the impact to date. And we could think about the astonishing implications of remote working or being laid off, because of course most people in the world are working in the informal economy. And so for those people living from day to day for their income, they've effectively been cut off from their means of provision. The second thing to think about is the longer term implications, which in fact worry me even more, which are the implications of economic recession in the future. And a colleague of mine, he's called Stigma, he said, recessions can hurt, but austerity kills. And we're facing now a period of huge economic austerity around the world, which could have catastrophic implications for mental health in all of our countries.
Thank you. So I think that we've had an idea of the big picture there. I'd like to bring it down to the very specific picture now and talk about one person's experience, specifically Enoch, your experience. Can you tell us a bit about your experience of mental health in the workplace?
Sure, I can, and hello everybody, it's great to be here. I would sum it up in to say that there are a lot of intentions, but these intentions are misaligned. And what I mean by that is, in a lot of our work with organizations in implementing mental health, we find that HR, for example, or management would like to do something, but then they like to avoid some of the more difficult topics. So they would say, let's talk about stress management, but let's not mention burnout or depression. But when we actually go into the workshop and we talk to the employees, we find that the curiosity is actually around, well, what really is this mental health condition? How do we know, and where can we look for help? So we find a lot of misalignment between management, what they want to do, and also on the receiving end. Plus also the company culture sometimes doesn't keep up with it. And specifically in COVID-19, what I've heard from some employees is they get invitations to webinars on relaxation and rejuvenation, looking after the mental health, and then subsequently an email from their boss to say, well, the targets have just increased. So I would say that we really need to be thinking through the whole picture comprehensively and not just say, let's do a mental health workshop at the workplace.
Yeah, so it sounds to me as if mental health at the workplace, that there's the possibility to be counterproductive here. There's the possibility that we raise the issue, the companies say great mental health in the workplace, but then make that an individual sort of duty and task of employees rather than thinking about the organizational structure as a whole.
Correct. Yes.
So what are you hearing from other lived experience advocates and organizations that you work with about what's needed right now?
One thing is reality. What I mean by that is giving people the real sense and picture of what it might feel like, for example, when we're having a panic attack. Because a lot of times we see webinars on resilience and building productivity. How do we stay productive at home? However, what that does, it shies away from the issues, and it actually accumulates the taboos that we already have around the topic. And I think secondly is what we find, and particularly I think through the Global Mental Health Peer Network, of which I'm part of, we see the need for more peer support, because a lot of people don't want to call necessarily a therapist. But if they find somebody who can support them, who can share the stories, who understands with empathy, then they feel much more comfortable in opening up. And I think that is one way which says, okay, well, by the time they need professional support, they feel ready to go for that.
Okay, thank you for that. Now, I'd like to turn to Emma Card from Deloitte, because Emma, I understand that Deloitte has launched some new research. Can you tell us about it?
Yeah, so thank you, Niall, and thank you for asking me to speak today. Our research that we just launched last week is our annual millennial survey. So this year we spoke to around 18,000 millennials in 43 countries around the world. Now, the research was actually, the interesting thing about this was we actually conducted the research pre-COVID. So it was sort of November, December, and then we went back and did a smaller pulse survey during COVID. So it's given us the ability to look both at the situation from a mental health perspective with this important demographic before, and then actually how they're feeling during.
Okay, so two questions, one really short question and one slightly more open one. The first is, when you say millennials, what age group that refers to? And
yeah,
secondly, about what this research showed.
Thank you. So the age group, when I say millennials, we've taken those individuals born between January 1983 and December 1994. And then actually within the survey population, we also included the demographic that we would refer to as Generation Z. And those are born between January 1995 and December 2003. And in total, it's 18,000. Around 14,000 of those were millennials. So in terms of the findings of the research, I mean, I think, you know, am I always surprised? Yes, sadly, I'm always surprised, and not necessarily in the right way. So we found that this is the pre-COVID results. We found that almost 50% of Generation Z, so the younger ones, and 43% of millennials said they feel anxious or stressed all or most of the time. Then we found that women are likely, or do tell us, that they feel more stressed than men among that population. So, you know, 53% to 42% amongst Generation Z, for example. And then, you know, this is unsurprising to me as a parent, but parents were more stressed than the average, and particularly Generation Z parents whose children are typically younger. And then I suppose just another couple of findings that, you know, that I think were very interesting. So when they were asked to prioritise the 6 aspects of their life, and they're ranging from personal safety to financial security, 48% of Generation Zs and 44% of millennials ranked mental health as either first or second priority, and actually only physical health was viewed by them as a higher priority. This generation, sadly, think they are going to be a lot less happy than their parents, and there's some interesting findings around that. Actually, 45% of millennials believe they'll be less happy. And then the final finding, which to me is you know, shows, I think, comes back to culture in the workplace. It's clear that the stigma is still there, it remains, and there's a lot of work to be done. So just over 50% told us they do believe that feelings of stress or anxiety are legitimate reasons to take a sick day. And then around a third of millennials, and almost the same Generation Z, said they had taken such time off. However, nearly half of those who have said they've taken time off told us that they've given their leaders a completely different reason for it. Now, you know, what does that tell us? Well, it tells us that the stigma is still there. It tells us this is a real issue. And actually, it tells us to come back, you know, to the first point made. How can an employer calculate the cost of this to their business if they actually don't have the transparency?
Thanks. I mean, the feeling I get is that we have this permanent and somewhat overwhelming state of anxiety, really, and that's deeply worrying. What is your company doing about this, about the findings of this report?
So around 70% of our workforce fall into that demographic, and we've been on the road to ensure that we're a mental health organisation for a long time. We are really focusing on stigma. We're focusing actually, you know, as Enoch said, you know, peer support. That's really, really important. Lots of people don't feel able, they don't want to phone a helpline. So we have champions. You know, I often say to people, it's almost like, you know, plastering a wall, and you put something over a bit and then another crack appears. Well, certainly that's how it works with my house. And I, you know, and that's what this is. This is a long journey, but to me, it's culture and stigma. And you know, leading this from the top, and actually having our leaders talk openly about how they feel and how they have felt, that's a big focus for us at the moment.
Thank you, Emma. Now, I'd like to turn to Sapna and to look about the national context in Canada. Sapna, how are you seeing workplaces prioritizing mental health across Canada during this pandemic?
I think the pandemic, unfortunately, has shone a light on the accountability and responsibility of workplaces when we talk about health and safety, keeping staff health and safety protected from foreseeable injury, that mental health is as important as physical health. And we saw that when the pandemic hit, obviously the first response reaction was let's protect people, physical distancing and PPE, protective equipment. But we've realized, and we say here in Canada, that mental health is the silent echo pandemic, and it will last much longer than the pandemic itself. And there's an acknowledgement from workplaces that we need to equally address the mental health. We need to expand our notion of health and safety to include mental health in the workplace and actually prioritize and take action.
Yeah, and so to put that together with what Emma said, it sounds as if the younger people especially maybe are have a less stigmatizing view of mental health, but there's still that degree of concern. It hasn't quite broken through yet.
Yes, and I think we still have, like many countries around the world, the stigma is there. It looks different in all different kinds of organizations. I think one thing we're seeing a lot that's helping is equipping and supporting managers. In a time of crisis, people leaders are critical. People look to them, and they're the make or break, especially with millennials and people who are going to be the leaders of tomorrow, or maybe the leaders mostly of today. It's really important to equip the managers and the people leaders, and give them the skills and the competencies, and show the value of leading with empathy, authenticity, and vulnerability at a time like this. And the companies that are doing that, we're seeing a very positive impact.
Thanks. Now I'd like to hear a little bit. Sorry, I think, okay, good. Could we just all mute our microphones for a moment? Thanks. So Sapna, I'd like to know a little bit more about some recent work you did on workplace mental health for the Asia Pacific Economic Cooperation Organization. Can you tell me a bit more about that?
Yes, APEC has a workplace wellness and resiliency group, which I co-chair with Japan. And it's been around for a few years, and Enoch actually has contributed to that group as well. But there's an acknowledgement from the Asia Pacific countries around the need to take action around workplaces. And as you can imagine, there's much in common, but there are some great distinctions and differences in where we're at. So the group has been working together to share practices, challenges, lessons learned, and we recently launched a white paper, which is really a framework on how do you start to mobilize and take action and really show that workplaces have a role and there are actions they can take. Mental health is not something that should be done separately and on the side. I think Enoch kind of alluded to this. You get misalignment. If you just do a workshop on the side or training, you're not changing the culture. It needs to be embedded. We say from recruitment to retirement and everything that you do, even if it's not mental health related, you have to think about how is this program, policy, decision, how is it going to impact the mental health of employees? And so really the framework talks a little bit about some of the best practices in the region and what are the simple steps we can take to take action.
Thank you. Now, I think this issue of different countries, different cultures of work is a very important one to address. Now, Graham, of course, your background is in global mental health, so you're familiar with the sort of push and pull. The idea is on the one hand, you're trying to promote this general concept of mental health, but then on the other hand, that needs to be very specifically adapted to the local context if it's going to be effective. And I wonder if you could maybe tell us a bit about how you would recommend businesses and other employers would address these regional differences, these country level differences in attitudes towards mental health, in funding, indeed for workplace mental health.
Thank you, Niall. So first of all, maybe we can think about the ways that workers and people in the workplace can think about these issues. And one way is to break it down into different sort of steps or levels. So you can think about things to do with individuals, things to do with teams, and things to do with the whole organization. And then we can also think about things to do which would affect everybody, or people, if you like, at risk, or particular groups, or people actually with, if you like, definite mental health problems. So you've got this 3x3 grid, if you see what I mean. So within that, you could then populate, and now there's actually a growing evidence base that we know what to do in all of those. But of course, the evidence is mostly from the high income countries. I'd like to pick up a specific issue that Emma raised, which is extremely important, which is aspects of stigmatization that form barriers to people getting help. So I've worked for a number of years. I'm based in London at King's College. I've worked with a number of years in a network of people, now about 40 countries around the world, doing work to understand and then to intervene to reduce, and we hope to eradicate, stigma. And it's quite clear that you can't simply take an intervention developed in one country and transplant it elsewhere. You have to adapt, you have to contextualize. So let me give you one example. We know the evidence, pretty much all the evidence about stigma reduction is based upon the idea of contact between people who do have experience of mental ill health and people who do not. Interesting, in these times, this was called until recently social contact, meaning having a meeting. But in fact, the evidence is helpful here because virtual or indirect or distance contact, for example, through videos or through other remote means, can be as effective to reduce stigma. And we know that this works in the workplace as well. We know that if you actually have programs, especially programs led from the top, in my country, I can think of British Telecom and HSBC Bank, who've had examples of this, where the top people have said, not only do we think mental health is important, but I myself, people will say, have had difficulties, I did seek help, I did get better, and now I'm resuming my role. And then that can cascade throughout the whole organization. It does mean taking this seriously and as a long-term proposition, not just for the bottom line and for return on investment, because it's the right thing to do morally as well.
Thanks. Now, of course, if you have your own experiences of workplace mental health in your particular setting, if you're listening to or watching this webinar, you can tweet about it using our hashtag, which is hashtag COVID-19MH. We're very interested to see what you have to say. But for now, I'd like to turn back to Enoch. Now, I was struck by what Graham said about this going from the top, and I think it can have a very good effect if managers or people higher up the chain talk about their own mental health issues, and that can do a lot to destigmatize. But one of the things which you said, which I was a bit concerned about, is the idea that employees might see mental health programs as things imposed on them, as which are things like, say, extensive mindfulness sessions, but which are nevertheless not really responding to their needs. So it has to be a two-way process. It's good to hear from people at the top, but people further down the organization also need to have their voices heard as to what they're experiencing and what their priorities are. And I wonder if, with your organization, with other organizations, you might give us some ideas to how to facilitate that.
I can think of an example of a client we worked with, which was a multinational corporation, and they had their pillars of well-being, which a lot of companies now do. And I think what they've done well is actually to give the region in Asia Pacific the autonomy to adapt and decide the priorities under all these pillars. I'm based in Beijing, so I work predominantly in China, Singapore, and Hong Kong. Those are where our clients are and where their regional officers are. And also what they did really well as well was to bring in the country level managers and employees and what their priorities and initiatives are. And actually what we did with them, instead of going in directly and say, let's run a workshop, we actually did focus groups with the employees across the region and taking a sample of, well, what really actually stresses me out? I mean, it's a bit of a generalization, but also in this culture that I'm familiar with, a lot of the stress actually comes less from the workplace, but more from the families. So parents stressing us out, when are we getting married? When are we going to have kids? When are we going to buy property? And when are we going to buy a car and a dog? And we bring these stresses from our personal life into the workplace, and sometimes it manifests itself. And like Graham said, it can also affect the team collaboration and that sense of cohesiveness in the organization. And so in the end, what we actually did with this client was, instead of run a workshop on stress management, we actually did a lot more work around communicating within relationships, families, parenting, and it seemed to be much more effective because people say, well, okay, I now know how to handle my own stresses in life, and so how can I park them and not bring it into the workplace?
Thanks, Enoch. Now, this issue of the specific generational need really feeds into the research, I think, which Emma, you were talking about with Deloitte. And if I may, I mean, it's very interesting you had a specific focus on millennials here, because these concerns were very generation specific. We know about that a degree of anxiety. We know about that degree of precariousness, which maybe they're experiencing, which previous generations haven't. Now, to what extent can you tailor mental health interventions towards generational concerns rather than simply regional or local concerns?
So I think, when it comes to generations, I mean, my own organisation, we are, I'd say 60 to 70% of our workforce does fall into the millennial demographic, but that does not mean they are the only part of our workforce that suffer from mental ill health. So again, for us, and actually listening to what Enoch was saying, and it's a very similar approach that we've taken. There are things that absolutely that we have, think are critical from a global perspective. But then, we're an organisation that we're in, over 120 countries around the world, and that each of those countries, have different societal factors. There are things that we need to look at, and therefore it's actually important that we're going out to our people and we're listening. So we've got this huge body of research, 18,000 individuals outside our organisation that are telling us one thing. Now we also listen to people within our organisation, and we again have done pulse surveys before COVID, during COVID, and actually the interesting thing to me that is a bit of a difference is the external research. During COVID, stress levels came down by 7-8 percentage points. And that could be because the individuals aren't physically going into the workplace. it's one of those things. There are other stress factors, and I'm certainly one of those overwhelmed parents that, I have really struggled during, the last 3 months. But our own people started to tell us, and again, I think it's back to one of Enoch's points. You're giving us things like yoga and mindfulness, and they're really interesting. But then think about how you're leading. And think about, again, it comes back to the culture. Now that to me affects all our workforce. That's not generational. It's just, I think that our millennials are maybe a little bit more vocal about their expectations, whereas sadly my generation, I don't think we were, and we have been vocal enough about it. So you do need the geographical differences, and then you need a number of principles that you're going to stick to. And again, it comes back to me to culture. Culture is so important. We can say one thing as an organization, but if your leader sends you an email at 11 o'clock at night expecting you to respond, that undermines everything that we then do as an organization. So, I think you have to tailor it, but to particularly from a geographical perspective, and then listen and act.
Thanks. And I'd like to follow up that with a question to Sapna. What have you seen as the key differences globally when it comes to workplace mental health?
Yeah, and I think one thing just to add that I really wanted to say was that everyone's been talking about that. You said culture, which I agree. I also think data. You actually have to figure out what the real issues are. Spend some time to gather information if you're able to as an organization to see what the real issues are and tailor it accordingly, because a meditation workshop might not even be the issue. And then actually measure your interventions. Are they working? Is so important. And I think it speaks to the differences. There's a lot of similarities around the world. We are all being impacted by COVID differently, but we are all feeling those impacts, and maybe they're highlighting and even enhancing some of the impacts you are already seeing. I think that people acknowledge around the world mental health. I think, like Enoch said at the beginning, there's the right intentions, the wanting. The differences we're seeing around the world is the language, how people are approaching this, and how workplaces are taking ownership of it. Some are saying, we don't really have a role in mental health, but we'll do a workshop. And some are saying this is really part of our health and safety. This is part of our culture. This is a priority. We're going to embed it in all that we do. So I think we're seeing quite a difference around the world. The intentions there, I think there's acknowledgement that mental health is an issue. We need to address it. I think where we see the differences is what is the role of the workplace? How much can we do and prioritize this? I think we're seeing, I think we're moving in the right direction, but I think really across the world, we're seeing quite a bit of differences in where people are at. And that white paper from APEC, as well as I know the World Health is doing work, and we're developing, the International Standard Organization is developing an international standard, is to try to leverage the differences. As Graham said, you want it to be tailored, the interventions, but it would be nice if we were all approaching the work and the commitment in a similar way. So I know there's a lot of international efforts taking place to try to leverage some of the similarities while allowing people to tailor their needs accordingly.
Thanks. Now, I'd just like to follow that up, Sapna, with a very specific question about this ongoing situation of people working from home. There's a large number of people who are working from home. And I think that this has to affect the social environment of the organization. The usual role which the work organization plays in socializing people and providing that kind of group identity, that kind of support, I can't help but think that is frayed and eroded by the practice of working from home, much as there might be many advantages to it. I wonder if you also think this is a problem, and if it is, if you have any idea what workplaces might do about it.
I think that it's been a big change for many, and here in Canada, even within our government of Canada, a lot have suddenly worked from home. I go back to some key pieces. We need to equip, I'm not used to working from home. I've got 2 little kids at home. It's a change. And but we are learning new ways to do it, and there are ways. And it's not just technology as a director, it's how you connect with your teams, it's how leadership communicates and bring people together. There are tools, tips. I think we really need to ensure we equip our employees and our people leaders. I've said it before, but I think people leaders are really key. And that's everything from your top management, but even just your managers at the front lines. I think we have to acknowledge business is not as usual and it's not continuing. We need to manage expectations. We need to talk about the difference in expectations, but I think you need to give people the tools. We can't just say we're now teleworking, now continue to do all this work. And we have to remember we need to really provide people with the tools to do that and acknowledge that it's different. And the expectations and the outcomes may be different as well.
Thank you. Now, getting some questions through from our audience. I've got a very quick one to start with, and then I'll move to a more detailed one. The very quick one is for Emma. How can people get access to the research that you've been talking about?
It's on our website. So I think it's www.deloitte.com, and you'll see it. It'll be featuring right on the front page of it. We're also currently about to publish a white paper that solely pulls out the mental health findings next 2 days. So watch this space.
Brilliant, thanks. Okay, so the next question I have, I think we'll start with Enoch for this one, which is commenting on the return to work and how to support people who are expected to come back to their offices.
I think part of it is acknowledging the experience and the varied experience that people have had. Some of the conversations I've been having with organizations here is some people like to move on, quote unquote. We're sick and tired of talking about COVID. We're sick and tired of talking about mental health in some ways. However, I think the danger of that is we sweep it under the carpet, because people, particularly I say from this side of the world, we're less inclined to articulate how we feel, and we tend to like to maintain the space of, you know, we're stoic and we've been able to do it. And so part of it is creating that space and psychological safety in the organization to say, let's process the experience. To some extent, for some people it could be traumatic, and to a less extent it could have come as a shock or surprise. And it's really important to process that emotions and say, we're here for you and with you, so that we can work together as a team.
Thanks. Graham, do you have any thoughts on this return to work? Because from what I've seen, it's not business as usual. Even when people are going back into offices, there are different arrangements in terms of the number of people who can go in terms of having to book in advance, the capacity of the office, even simple things like how many people can get into the lifts. You know, it's a changed environment. How can people be helped to adapt to this?
So thank you, Neil. So the last 2-3 months now, so many people have said to me, it's like a roller coaster. I've got good days and bad days and anxious days and depressed days and, you know, obsessive thoughts, all sorts of things mixed up. So it's like the normal emotional experience has been intensified like a pressure cooker. And I think that won't stop soon. And particularly for first responders and key workers and so on, many people have been working under really unacceptably intense conditions for long periods. Many people not had holidays for many months, many people feeling guilty for what they haven't done or what more they could have done and so on. So this is really a very intense time for many people working. And going back to the office, for some brings relief. So you just talked about the nature of what is lost by working at home. Of course, there are many gains, but one could think about, if like, the transactional parts of work, the nitty-gritty content of the work, but also the relational parts, the sort of human, treating people like people, and the gossip and the sort of the chit-chat, which is also really important for many people. So I think one can't generalize. Some people are now feeling very worried about being in any proximity to colleagues because of the transmission of the disease. And for some people now, coming out of lockdown is a period of great fearfulness as well. So one's got to actually tune into each individual, and that's usually for a line manager, maybe human resources, maybe an employee assistance program, to try and check out where somebody is at emotionally and how they could be helped into the next phase. Now, it may be also fearfulness of actually inevitably for a long period working at home. That's one thing to sit at home for 2 months. Quite another thing to think, is this the next year, the next 2 years? And people could have very strong and mixed feelings about that as well. So it's a time of great uncertainty in terms of our work prospects at the moment.
Yes, but you know, at the same time, clearly organizations will have certain expectations which they have of their employees. And I wonder, Emma, about how you strike that balance between, on the one hand, wanting to help people and to individualize the return to work or the way in which they manage working from home. How flexible can employers be in this?
So we, I believe, I mean, you know, we're a client-serving organisation, and there are, you know, some of our work requires us to be on client site, and therefore we will get to a situation where that will happen as long as the individuals concerned, you know, are comfortable. I mean, all we have are our people, and to me, I think this comes back again to the people leadership, you know, perspective, in that I've spoken to members of my team who are actually faced with the prospect of most likely carrying on working from home for at least the next 6 months. And you know, some of them are depressed by that, some of them are relieved by that. And again, it's the ability to have that conversation where we can talk that through, and we can talk about what could we do to make that feel a little bit better, and what couldn't we. It's exactly the same for those that are going into the workplace. I mean, we have these restrictions. You know, as I said, we are a huge organization around the world. Each country has different requirements, and the most important thing is our people, that they, you know, that they feel able to voice where they do have concerns. But it is, you know, it's something we've got to manage. I mean, the biggest word I hear at the moment is the word scared. That's where you have conversations with people, that's the most frequently uttered word. And that means that, you know, people are, very, as Graham said, very fearful, very scared. And it's down to us as employers to show that we are responsible and that we would take all steps, not to jeopardize physical and mental health.
That's interesting in the context of what you said earlier about anxiety, because it strikes me that maybe especially for younger people, and especially at the moment, the future is something which people are not anticipating with excitement or interest. It's something which they're anticipating with fear, and clearly that has to affect mental health and indeed the workplace. So I'd like us just to cast our minds a bit into the future now, and Sapna, I'd like your help with this. People have written and have speculated that the world of work will be permanently changed as a result of this pandemic. Do you think this is the case? If so, how will it be changed? And what are the mental health consequences that will arise from that?
I think it will be changed. I think all over the world you'll see a change. I think you'll see some positive pieces. I know here in Canada, I even know with my own team, I said, we got to work together. We have to be in the office and see each other. And I've seen that we can do our work remotely. I think there'll be some benefits that do come out of this. But I think no matter what, you know, we try not to use the language in Canada, return to work, because most of us continued to work. It's more about returning to the work sites. And Graham, you mentioned there's quite a bit of positives about being at work, but the new workplaces, at least while COVID is still around, might not give those benefits, because you can't go in an elevator with someone and you can't sit close to anybody and you might not be able to hug and get coffee. So I think the workplace has changed. And I think as workplaces start thinking about their guidelines on how to return to work, or if there's a surge and we have to increase restrictions, lots of workplaces are putting guidelines into place and putting policies. I think we need to think about the mental health impacts and the conversations we need to have. What flexibilities are we offering and how are we going to come to those decisions? And let me say from leadership standpoint, how you implement those policies and guidelines. They might be right. People can't work here, people can do this, but it's how you communicate and have those conversations with people, that you've listened to them, you've considered, you've tried to equip them. All those pieces is what's going to make and break the mental health, I think, of people across, at least on the professional side and workplaces. It is so critical. And my one piece to keep in mind is that, as Graham said, unfortunately, this is not over soon. It's going to be a bit of a roller coaster. We might ease restrictions, increase restrictions, and each country will be different, even within countries. Let's think about, as we put things into place to help people physically, how are we helping them on the mental health side? And how are we protecting the mental health, just as we do and talk about for physical health and safety? How are we doing that for mental health?
Thanks, Sapna. So Enoch, I'd like to hear from you. Do you think that the workplace is going to be permanently changed by this thing? And how will your organization adapt to these changes and the kinds of services and advice which you offer?
I agree with Sapna that it will change, and it has changed in a lot of ways. In Beijing or most of China, we have quote unquote returned to the workplace for almost 3 months now. And I see a range of some organizations feeling like they need to catch up, and they've actually mandated their employees to be in the offices for 9 hours. And there are some companies which are much more flexible. And what I admire of how the leaders have managed it is that they trust their employees to make the decisions on how and when they come into the workplace. And then, of course, a lot in the middle spectrum of this is how we stagger the schedules. And in responding to that, how we have changed as well. One, obviously, we're doing a lot of our work online, but we're seeing some of the smaller events come back offline. We're actually doing a roundtable here with one of the chambers of commerce, and to my surprise, the seats filled up very quickly, which is very different from the experience I've had last year, where sometimes we have to beg people to come so that we can talk about this topic of mental well-being. And I think secondly, what has started to change is organizations are now actively approaching us for advice and not just, can we do a workshop? They're thinking much more strategically, I think, to the point what Emma was talking about, the longer term strategy. It's not just initiatives, but let's have a plan. How does it sustain? And what are the processes within this culture and organization that we have to change in addition to equipping our employees with the skills and knowledge?
Thanks. So the message I'm getting overall from this discussion is that this is potentially a very long-term issue, that companies are going to have to be adaptable on the grand scale and with individual employees. The stigma is an issue still that can be addressed at the top. At the same time, people need to listen to voices from all the way through a particular organization. And finally, that much as we love yoga and much as we love mindfulness, there are practical issues of well-being in the workplace which need to be addressed structurally. So that's the message which I'm getting. And I'd like to round off really by asking the elevator pitch question. This is, of course, an appropriately physically distanced elevator that we're in. And I'd like to ask each of our panelists in turn to end by naming their top priority action to address workplace mental health now and in the future in the light of this pandemic. So first of all, Graham.
Thanks, Niall. So I think if I can reverse the future, I think we need to give credit for the leadership to the World Health Organization, because led by Aisha Malik, they're now producing guidelines for work and mental health. So before long, we'll have very detailed evidence-based guidance. But for the now, the key thing I'd say is creating opportunities for safe disclosure, safe ways to talk about mental health, which will be different settings, but also for different people. So it may be going to a peer support worker, it may be going to a line manager, employee assistance program, to a third party, to a phone line, a chat line. We have here the royal family doing great work supporting ways, for example, to help men who don't like to talk, but maybe will go to a chat line. So it's creating spaces for safe ways to talk about mental health, so you can get support, and if need be, you can get help and treatment as well.
Thank you. Emma.
I think culture, addressing stigma, and the big thing for me is that everybody, when they are asked, are you okay? Number one, that they feel able to be open and honest about it. And number two, the person that is asking them knows and understands how to signpost them to the help that they need and that the help is in place.
Thank you. Sapna.
Yeah, leadership commitment, genuine, that's aligned. I think integration and all that we're doing to address the pandemic, we really need to think about the mental health impacts, not just physical. Addressing stigma, measurement, and I know I've said it several times, but I see the impact is people leaders. We need to make sure we have the right people in place that are leading with empathy, authenticity, that can do what Emma and Graham are saying. Creating that space and environment that people can come forward and they actually know how to have a safe conversation and support them.
Thank you. And finally, Enoch.
I'd say give people the real picture of what it's like, especially through the stories of those who have lived the experience. It normalizes the conversation. It helps people understand what they're feeling and when to look for that support. And I think also very importantly in these days is to give people that hope that we can get through this.
Well, that's an optimistic note to end on, so I think we will end there. Thank you very much to all our panelists for joining us. Thanks to you, the audience, for joining us as well. Now, if you want to find the WHO's guidelines on workplace mental health, they'll be tweeted out using our COVID-19MH hashtag. We'd like you to join us for more webinars. There's one next week, same time, on mental health and poverty alleviation. That's followed on July the 14th by one on supporting parents and carers through different innovative approaches. So please join us for those. But for now, thank you very much for joining us. I'm going to be on Twitter and the Lancet Psychiatry account. I think some of our panelists are as well, if you'd like to continue this discussion. But for now, thanks again and goodbye.
Bye.